Good morning. My name is Steve LeCroy. I am the Director of Clinical Support at Mercury Medical. Today's video is going to be a short training presentation on FlowSafe II Plus, which is a disposable BiLevel device. This device is potentially can be used in the surgery center for patients instead of bringing in their units from home, which a lot of places don't find that to be acceptable, and we also have a lot of undiagnosed people that CPAP may be an advantage or helpful after a procedure, whether it's in a surgery center, hospital, and EMS is also uses this device quite often. So I wanted to really just a couple of statements about BiLevel. Most of you may have heard the term BiPAP instead of BiLevel. BiPAP is a trademark name, so we don't use that, we BiLevel, but BiPAP stands for bilevel positive air pressure, so we're really talking about two terms that are interchangeable. So the device we're talking about today, FlowSafe II Plus, is a CPAP device and a BiLevel device, and yes, there are differences. We could have another talk on that, but the big difference between the two is CPAP makes the work a little easier. BiLevel helps the patient do the work. And that's really, if you walk away with anything on that, that's probably the biggest one. But I want to introduce the product now is the FlowSafe II Plus. You can see it comes in a bag that looks like this. It's got a very small footprint, so storage generally is not a problem. When you take it out of the bag, you only have two parts. I'm a paramedic respiratory therapist, but you're not going to need a respiratory therapist to do this. You're going to find this to be very simple to use, very easy to use. The steps are simple, the parts are only two. So when it comes out of the bag, basically you have the FlowSafe II Plus valve and you have a mask. Now you can see in the video, I've got it on a glass head. This is what it looks like, and some people think that looks kind of like the toucan bird. I got this big nose sticking out here and that's going to be heavy and drawing down the face. And it really isn't. It's actually very light, and you'll be able to see that the first time you have the opportunity to put your hands on it. So we have two parts. We got the valve, we got the mask. There is only one way to put it together. It can only go here. So that it can't be placed any place else. So comes out of the bag, two parts, goes together. I want to talk a little bit about the mask before we get into the valve. This is a very comfortable mask. I think is really important for compliance. You'll notice that we've got the harness here. It's a very elastic Velcro, 4 attachments to make it easier to fit. Remember, a mask for CPAP doesn't have to be skin tight. It really only has to be airtight, and I'm going to show you how to check that as we go through the process. Now, if you look at the back of the mask, when you get a chance to look at one and have it in your hands, if you look at the back, the inside where the seal is, this is actually a double seal, and we have found using a double seal works well with a variety of patients. Patients with beards now might not be more of the Duck Dynasty or ZZ Top type beard, but we have had almost zero issues with getting a seal, so that's really important. There are times that you may have to make access to the patient's face. Now, some masks that are on the market, you have to take the whole harness system off, then you got to reset it, get it onto the patient's face. This particular mask, on each side of the mask, there's actually a blue clip. You can unclip it, you can lift the mask up because the harness is very flexible. If the patient needs a medication, if the patient needs, you want to give them a drink of water or something like that, much more simple to do than having to take the whole harness off and resize it. So that's a distinct advantage. You'll notice on the mask there is a forehead piece. Most patients complain of a mask about where you see my glasses are fitting, and they kind of get an ulceration some there, and it's not very comfortable to do that, and then they're not as compliant. Once the mask is on, all you have to do, if you look closely, there's two tabs right here, and all you have to do is squeeze those, and if there's any tension on the nose area, it will rotate it away. Now you may have to make a little bit of adjustment to make sure that you got a seal, but that's very easy. It's unlimited adjustments because it's Velcro. Like I said, two here, and one here, so we have 4. On the front, there are little black nipple here, and there's one that should be on the other side. You probably are not going to have any use for those. This device is run off of either oxygen or medical air. That type of thing can be a tank, can be a wall like you see behind me here to be able to do that. Some places in the world want to do their CPAP on room air. And if they want to give some oxygen, you can actually hook up oxygen tubing to these nipples and run some liters into that. There's a lot of concern these days with oxygen toxicity and that type of thing. Topic for another time, but that's what those little things are for. So we have a very comfortable mask. Now I don't know if I'd want to sleep in it like it's for sleep apnea, but for short periods of time, 4, 5, 6 hours, generally people aren't having any issues. So good quality mask. Patients that don't have good seals, patients that are not comfortable, are not compliant with the therapy. So that's why I really like to start there. When we look at the valve itself, it looks like it's very complicated. It's got valves and diaphragms and all kinds of stuff, but you're going to find that this is a very simple device to use. To look at the components, it's got a manometer. Manometer, obviously, that's where we're going to adjust and make our pressure changes. The manometer has a couple of other things that have value other than just monitoring pressure. If the manometer doesn't register, it probably tells you don't have a good mask seal. If the person inhales and the manometer goes to 0, it's probably not providing fast enough flow, what someone like me as a respiratory therapist would call peak flow. So you don't want the patient over breathing it. That's generally not an issue with FlowSafe, but if you don't have the manometer, you don't know that occurring. And if they're not getting enough flow, patients will not be compliant. In fact, their difficulty breathing and shortness of breath will probably increase. There is a pressure pop-off valve here, generally not necessary in most cases, but if there was some reason something got clogged and we had a spike in pressure, it's going to pop off so we don't cause any injury. There's 2 diaphragms here. One diaphragm is labeled EPAP, that's how you adjust your expiratory pressure, and the other one doesn't have any knob or way to make an adjustment because your inspiratory pressure is going to be adjusted at your flow meter or at your gas source, which I'm going to be demonstrating that here in just a moment. On the end, there is a green knob that you can turn and select either CPAP, which is single level pressure, or BiLevel, where you have 2 different pressures. The purpose of having 2 different pressures, your expiratory pressure is always going to be lower when you set it up than your inspiratory pressure. There should be a gap between those 2 numbers. Like if I wanted them 10/5, that 5 in between is what we call pressure support. So we want to have at least 5 to give them a kick. So when you exhale against a resistance, say in this case 5, when you inhale and it jumps to 10, that helps you inhale. That's how a BiLevel device helps the patient to breathe. So this one can give you probably a maximum inspiratory pressure of probably right around 12 or 13, and your EPAP can be adjusted off that. And that's going to make sense when I go ahead and demonstrate this. Now it will come out of the package in the CPAP mode. Now we do that on purpose because if you follow the correct steps of using this device, it actually performs much better, and it's best to make sure you've got a good seal, that your flows are okay before we go into the BiLevel part of it. So what I'm going to do is I have a larger manometer here because obviously people watching the video are not going to be able to see the one in front of me, and I'm going to go through the process. Now just before I do that, I always find that, and imagine here that I've got the valve on here, and it just so that everybody can see. If I'm going to apply this on a patient, I would take the strapping and I would invert it. Okay, so it's over the inside of the outside of the mask. Already have it flowing. It's going to make some noise. Explain to the patient that that's just the air blowing. This is going to make it a little bit easier for them to breathe, that type of thing, whatever verbiage that works for you. Let them kind of hold it a little bit. People like to be in control to a certain extent. And as they bring it up to their face, once they get a seal, you'll see it register on the manometer, and let them take a few breaths that way. Once they start to get comfortable, then bring your harness over their head and snug it down with your Velcro. The other option is to unsnap it, Do the same process that you're bringing it up to their face. When you bring it over, just snap it on either side. You could use both sides open or whatever. But I think it's really important to get the compliance with the patient is to let them be involved in it. Give them the heads up on the noise. It might feel a little claustrophobic. It's going to be blowing in their face. And sometimes it takes a little bit of working with them with their breathing instead of just slapping this on somebody's face and walking away. If they've never used it, now if somebody's used CPAP at home, they're using it for sleep apnea, they're going to be quite comfortable with this in most cases because obviously they've been doing it. So, to use the FlowSafe II Plus, I've got it in the CPAP mode. Remember, it comes out of the package that way. I've got my big manometer. Instead of using a mask, because obviously I'm providing information in between, now your tubing, regular oxygen tubing, is going to hook up to a flow meter. I've got it hooked up to an oxygen flow meter. There's a little Christmas tree on it to be able to do that. On the end of the tubing, there's a blue sticker. The blue sticker will tell you what flow that you need to be on your flow meter or your tank to get the pressure you would want. Now, obviously, you'll probably have a protocol or the physician's going to give some direction. I've always felt 10/5 was a good place to start. It's a kind of a safe area. Whenever you put positive pressure on somebody, there are some minor risks to it, but start safe, assess your patient. If the patient is improving, stay there, would be my recommendation. Again, I'm not a physician. And if the patient needs a little more, you can make your adjustments according to the protocol or the orders that you have. So, according to the sticker, if I put this on a oxygen flow rate of 8, I'm going to get roughly around 5 of CPAP. Remember, I'm in the CPAP mode, so I'm going to do that. Now you'll notice it's not registering because it's not sealed. It's got to be sealed before you get any kind of register. So now you'll notice it's not quite on 5, so I could make a slight adjustment to get that. But you need to realize, even though I'm looking for 5, the needle will not stay exactly on 5 as the patient breathes. And the reason for that is we're changing intrathoracic pressures as we inhale and exhale. So we want to see it moving. We want it to average about 5. Okay? So I'm going to turn it up just a little bit. Now you notice I overbreathe that on purpose. I draw it down. Most of these patients cannot do that. I don't have any lung disease, I'm not having an asthma attack, so I'm not having any issues with that. So once I feel comfortable that I've got the 5 and the manometer is registering, letting me know my seal is good, letting me know my flow is fast enough, and I want to go to BiLevel, my next step is to turn the flow rate up to get a CPAP of 10. Not BiLevel yet, we're still in the CPAP mode, but I want to get to 10 because that's setting my inspiratory pressure. If you remember, my idea was to go to 10/5. So I'm going to turn the flow up. As you can see, it's averaging about 10. My mask seal's good, flow's good, everything is looking all right. Now I want to go to BiLevel. All I have to do is flip the switch on the end to the BiLevel mode, and then watch what happens. Now since I've used this one before, it's pretty much set for me, and you can see as it goes to 10, our average is 10, average is 5, average is 10, average is 5. If it wasn't averaging 5, then I use the little knob that's labeled EPAP, that's the expiratory pressure, to just what I want. Okay, so as you can see, very simple process to do, but it's important to follow those steps. Is get your established with 5. Everything's sealing good, pressure's good, flow's good. Okay? Then go up to 10, still in the CPAP mode. Everything stays good. Now I can flip to the BiLevel mode, because I just set my inspiratory pressure. You're going to hear people say the term IPAP. That's inspiratory positive airway pressure. Now I can use the little knob to adjust the EPAP. And now I'm good to go. Now if you want to use capnography, end-tidal CO2 with this, there's 2 ways of doing it, and one way doesn't work very well. You can you can see my glass head here. There's actually an adapter that can go in between. It's actually used on an endotracheal tube, will fit there. The problem with doing it that way is the gas flow, not always the volume, but the velocity, how fast this is moving, washes the CO2 out. So if you're doing capnography and you're looking for a good waveform, you're not going to get it. It's going to look like a coarse V fib. It's not helping you out. If you want to do capnography, the best way to do it is to use the cannula style interface, gas line, goes under the mask, and the seal is so good with this mask, it doesn't create a problem. And then your capnometry, the number, or the capnography, the graph, are going to be pretty accurate. So I would recommend, if you're going to do that, that's the best way to do it. Now, if you want to give a breathing treatment, now, and maybe something that's part of your protocol, you want to be able to give a nebulizer treatment, you basically have to tee it in. Nebulizers, a lot of times, small volume nebulizers hold about 2 pre-filled, would go in between, but you need a second gas source, obviously, to run the nebulizer, but you can tee it in between. At this time, I would recommend that you only do that in the CPAP mode. However, we are doing some tests to see if we can actually do that in the BiLevel mode. But that's just a side note if that's something that you would like to do with the FlowSafe II+. So when you're done, basically you can unclip it, take it off the patient. This is totally disposable, the whole thing, mask, valve, and everything, and get rid of it. Don't have to clean it, don't have to do anything with it. So that's pretty much a quick introduction in following the steps. Again, it's important to follow the steps. I can't highlight that too much. You will get a better performance on the device. And if you follow the steps that I gave earlier about coaching the patient, letting them hold it, let them get a seal, ask them how they feel, those types of things, I think you're going to find your therapy to be much more effective. So if you have any questions, my email address is LeCroy, that's SLECROY, @mercurymed, all one word, .com. I hope you find this helpful, and have a good day.